There was one moment in my career that changed everything. One decision that went against every protocol, every hierarchy rule I had ever learned. A moment where I had to choose between my job and a human life. And I chose the life. What happened next almost destroyed my career, but I would do it again without hesitation. This is my story, and it is completely true. My name is Grace Wellington, and I have been a surgical nurse for 12 years. I grew up in a small town in Ohio, where everyone knew everyone, and life moved at a slower pace. I always knew I wanted to help people, so after high school, I moved to Boston to pursue my nursing degree. It was not easy. I worked 2 jobs to pay for school, barely slept, and questioned my choice more times than I can count. But I made it. I graduated with honors and landed a position at Massachusetts General Hospital, one of the most prestigious medical centers in the country. For years, I was known as the nurse who never questioned orders, who followed every protocol perfectly, who stayed calm under pressure. My colleagues respected me. The doctors trusted me. I had built a reputation on being reliable, precise, and obedient. That last word is important, because it is exactly what I stopped being on the day that changed everything. It was a Tuesday in March, and I remember the weather was unusually cold for that time of year. The kind of cold that seeps into your bones and makes everything feel heavier. I arrived at the hospital at 6 in the morning for my shift in the surgical wing, and I could already feel the tension in the air. We had a full schedule, back-to-back surgeries, and everyone was on edge. Dr. Harrison Blackwell was the chief surgeon that day. He was a legend in his field, 58 years old, with 3 decades of experience, and a reputation for being brilliant, but difficult. He did not tolerate questions, he did not accept suggestions, and he certainly did not like being challenged by nurses. I had worked with him before, and I had learned to keep my mouth shut, and my observations to myself unless absolutely necessary. That morning, I had no idea that keeping quiet would soon become impossible. If this story has already pulled you in, go ahead and subscribe now to the channel, because what comes next is going to surprise you even more. The patient arrived at 7:30 in the morning. His name was Michael Torres, 42 years old, a father of 3 from Cambridge. He had been in a severe car accident the night before, and the damage was extensive. Multiple fractures, internal bleeding, and a punctured lung. He needed emergency surgery immediately, and Dr. Blackwell was assigned to lead the procedure. I was part of the surgical team, along with 2 other nurses, an anesthesiologist, and a resident doctor. The operating room was cold, sterile, and filled with the familiar sounds of beeping monitors and the hum of medical equipment. Outside, through the small window, I could see the gray Boston sky threatening rain. Inside, the atmosphere was even heavier. Dr. Blackwell entered the room with his usual commanding presence. He scrubbed in, reviewed the scans quickly, and began issuing orders in rapid succession. His confidence was both reassuring and intimidating. He had done thousands of surgeries, and he moved with the kind of precision that comes from decades of practice. But I noticed something in his eyes that morning. He looked tired, more than tired actually, exhausted. I later learned that he had been on call for 36 hours straight, but at that moment, I just sensed something was off. The procedure began. Michael Torres was under anesthesia, his chest open, his life literally in our hands. Everything seemed to be going according to plan for the first hour. Dr. Blackwell worked methodically, repairing the internal damage, stopping the bleeding, stabilizing the vital organs. But then I noticed something on the monitors. Michael's blood pressure was dropping, not dramatically but steadily. His oxygen saturation was also declining, just slightly, but enough to make me concerned. I glanced at the anesthesiologist, but he seemed focused on his own readings. I looked at the other nurses, but they were assisting Dr. Blackwell with instruments. I was the only one watching the monitors closely. Thank you for staying with me this far. It shows that you feel what I felt when I lived through all of this. So go ahead and subscribe and turn on the notification bell, because what comes now changes everything. I cleared my throat softly and spoke up. Dr. Blackwell, I am seeing some changes in the vitals. Blood pressure is dropping, and oxygen saturation is down to 87%. He did not even look up. It is within normal range for this stage of the procedure. Continue monitoring. But it was not within normal range, not for this type of surgery, not with this level of trauma. I had been in enough operating rooms to know when something was wrong. The numbers kept declining. 85%, 83%. I spoke again, louder this time. Dr. Blackwell, I really think we should address this. The oxygen levels are concerning. This time he did look up, and his eyes were sharp, annoyed. Miss Wellington, I am aware of the readings. I have been doing this for 30 years. Please focus on your responsibilities and let me focus on mine. The resident doctor glanced at me nervously. The other nurses avoided eye contact. Everyone in that room knew better than to challenge Dr. Blackwell, but I could not ignore what I was seeing. Michael Torres was a human being, a father, someone's husband, and the monitors were telling me that he was in trouble. I watched for another 2 minutes. The blood pressure continued to drop, The oxygen saturation hit 80%. I could see the color of Michael's skin changing slightly, a subtle shift that most people would not notice, but I did, and then I saw it, a small but significant accumulation of fluid in the chest cavity that had not been there before. It was not massive, but it was enough to compromise his breathing, especially combined with the punctured lung we were trying to repair. Dr. Blackwell was so focused on the internal repairs that he had not noticed. Or maybe he had noticed and was planning to address it later, but later might be too late. Now I want to hear from you. Where are you watching this story from? Write it in the comments. It is incredible to see people from so many places following stories like this. I made a decision. Dr. Blackwell, there is fluid accumulation in the chest cavity. We need to drain it now. His response was immediate and furious. Miss Wellington, step away from the table. Now. I froze. Everyone in the room froze. The resident doctor's eyes went wide. The anesthesiologist finally looked up from his monitors. One of the nurses whispered my name like a warning, but I could not step away. Not when the monitors were screaming at me. Not when I could see Michael Torres slipping away right in front of my eyes. Dr. Blackwell repeated his order, his voice like ice. I said, step away from the table. You are dismissed from this surgery. Leave the operating room immediately. My heart was pounding so hard I could hear it in my ears. This was it. This was the moment where I chose between my career and my conscience. I looked at Michael Torres on the table. I looked at the monitors. I looked at Dr. Blackwell, whose face was red with anger and exhaustion, and I walked toward the door. My hand touched the handle. I could hear Dr. Blackwell barking orders to the other nurses, continuing the procedure as if nothing had happened. I could hear the steady, too slow beeping of Michael's heart rate monitor. I opened the door slightly. The hallway outside was empty and quiet, and then I stopped. I turned around and looked at the monitors one more time. Michael's oxygen saturation was at 78%. His blood pressure was critical. His heart rate was becoming irregular, and in that split second, I made the most important decision of my entire life. In Chapter 5, I let go of the door handle and ran back to the operating table. Dr. Blackwell's head snapped up. What the hell do you think you are doing? Get out! I ignored him completely. I grabbed the necessary instruments and positioned myself at Michael's side. I need to insert a chest tube now. His lung is collapsing. You are relieved of duty, Dr. Blackwell shouted, his voice echoing off the sterile walls. Someone get her out of here. But no one moved. Not the resident, not the other nurses, not even the anesthesiologist. They all just stood there, frozen, watching me work. My hands were steady, even though my mind was racing. I had done this procedure dozens of times, but never against direct orders. Never with a furious surgeon screaming at me. I made a small incision between Michael's ribs, inserted the chest tube with precision, and immediately we saw the fluid begin to drain. Dark, blood-tinged fluid that had been compressing his lung. Within seconds, Michael's oxygen saturation began to rise. 79%, 81%, 84%. His blood pressure stabilized. His heart rate became regular again. The monitors stopped their alarming decline and returned to safe levels. The operating room fell completely silent, except for the steady beeping of the machines. Dr. Blackwell stood there, his hand still inside Michael's chest cavity, frozen in place. He was staring at the monitors, then at me, then back at the monitors. The resident doctor let out a breath he had been holding. One of the nurses whispered something that sounded like, "Oh my God," and I just stood there, chest tube in my hand, waiting for whatever would come next. Being me, the rest of the surgery proceeded in complete silence. Dr. Blackwell finished repairing Michael's internal injuries, but he did not speak another word to me. He did not even look at me. When he needed an instrument, he gestured to the other nurses. When he needed information, he asked the resident. I was invisible to him, but I could feel everyone else in the room stealing glances at me, their expressions a mix of shock, admiration, and fear. The surgery took another hour and 40 minutes. Michael Torres was stable throughout. When Dr. Blackwell finally closed the incision and stepped back from the table, he stripped off his gloves with sharp, angry movements. The anesthesiologist began the process of waking Michael up slowly, and we prepared to transfer him to the intensive care unit. Dr. Blackwell left the operating room without a word, the door swinging shut behind him with a heavy finality. The resident doctor approached me carefully. That was the bravest thing I have ever seen anyone do in an operating room, or the stupidest. I am not sure which. I was not sure either. My hands were starting to shake now that the adrenaline was wearing off. We got Michael to the ICU and I gave my report to the receiving nurses. His vital signs were good. His prognosis was positive. He would make it. And then I went to the staff locker room and sat down on the bench, trying to process what I had just done. 20 minutes later, my supervisor found me. "Grace, you need to come with me. Dr. Blackwell has filed a formal complaint. There is going to be an investigation." I nodded. I had expected this. What I had not expected was how calm I felt. I had saved a life. Whatever happened next, that fact would not change. Chapter 7. The hospital placed me on immediate administrative leave pending the investigation. I was not allowed to work, not allowed to enter the surgical wing, not even allowed to to speak to the other nurses who had been in the operating room that day. It felt like punishment, even though they called it standard procedure. The next few days were a blur of meetings, interviews, and reports. I had to give my statement multiple times to different administrators, to the hospital's legal team, to the medical board representatives. Everyone wanted to know the same thing. Why did you disobey a direct order from the chief surgeon? My answer was always the same: because the patient was dying, and I had the knowledge and ability to save him. Some people seemed to understand. Others looked at me like I had committed an unforgivable sin against the sacred hierarchy of the medical system. The hospital staff was divided. Some nurses reached out to me privately, sending messages of support, telling me I did the right thing. Others avoided me completely, as if my disobedience was contagious. I heard through the grapevine that Dr. Blackwell was furious, that he was demanding I be fired and have my license revoked. He claimed I had undermined his authority, endangered the patient with an unnecessary procedure, and created a dangerous precedent for other nurses to question doctors. But then something unexpected happened. Michael Torres woke up. He was weak, in pain, but alive and conscious. And when his wife asked the ICU nurses what had happened during the surgery, one of them told her the truth. She told her that I had saved his life. Michael's wife, Elena Torres, demanded to meet me. The hospital tried to prevent the meeting, citing the ongoing investigation, but Elena was persistent. She threatened to go to the media, to file complaints, to do whatever it took. Finally, they allowed a brief, supervised visit. I met Elena in a small conference room on the 3rd floor. She was a petite woman in her late 30s with tired eyes and a fierce determination. She hugged me before saying a single word, and I felt her shaking. You saved my husband. You saved my children's father. They told me what you did. They told me you risked everything. I did not know what to say. I just did what any nurse should do. No, she pulled back and looked me straight in the eyes. You did what no one else was brave enough to do, and we will never forget that. Over the next week, Elena became my unexpected advocate. She wrote letters to the hospital administration. She contacted medical ethics boards. She even started a social media campaign telling Michael's story, though she did not use my name to protect my privacy. The local news picked up the story, running headlines about a nurse who defied orders to save a patient's life. Suddenly, the investigation that was supposed to be quiet and internal was very public, and that changed everything. The medical board had no choice but to examine the case thoroughly. They requested the surgical recordings, the monitor data, the anesthesia records. They interviewed every person who had been in that operating room, and they brought in independent surgical experts to review the procedure. What they found was damning, not for me, for Dr. Blackwell. The experts confirmed that my intervention had been not just appropriate, but critical. Without the chest tube, Michael Torres would have died within minutes. His lung was collapsing, his oxygen levels were reaching fatal territory, and the fluid accumulation was severe enough to cause cardiac arrest. But the investigation revealed something even more disturbing. This was not the first time Dr. Blackwell had ignored warnings from surgical nurses. Over the past 3 years, there had been 4 other incidents where nurses had raised concerns during his surgeries, and he had dismissed them. In 2 of those cases, patients had suffered complications that could have been prevented. The hospital had quietly settled with those families and buried the complaints. No one wanted to challenge the brilliant Dr. Harrison Blackwell. No one wanted to admit that maybe brilliance and exhaustion and ego were a dangerous combination. The medical board concluded that Dr. Blackwell had been operating while severely fatigued, that his judgment had been compromised, and that he had created a hostile environment where nurses felt unable to speak up about patient safety concerns. He was suspended for 6 months, required to undergo additional training on team-based surgical practices, and mandated to work with a supervision committee upon his return. I was fully exonerated. More than that, the board commended my actions and recommended that the hospital implement new protocols, allowing surgical nurses to escalate patient safety concerns, even against a lead surgeon's orders. I was reinstated immediately with back pay and a formal apology from the hospital administration. But nothing was the same. When I returned to work, the other doctors treated me differently, some with respect, others with resentment. The nurses were divided. Some saw me as a hero. Others saw me as someone who had broken an unspoken rule and made all their jobs harder. Dr. Blackwell never spoke to me again, even after he returned from suspension, and honestly, I was okay with that. It has been 2 years since that day in the operating room. Michael Torres made a full recovery. He went back to his job as a high school teacher, back to his wife and 3 kids, back to his normal life. We stayed in touch, and he has become a friend. Every year on the anniversary of his surgery, he sends me flowers with a note that says, "Thank you for choosing courage." I think about that day often, not with regret, but with a deeper understanding of what it means to be a nurse. We are not just assistants to doctors, we are advocates for patients. We are the ones at the bedside, watching, monitoring, noticing the small changes that can mean life or death. And sometimes, being an advocate means standing up even when it costs us everything. I still work at Massachusetts General Hospital. I still scrub in for surgeries. But now, when I speak up about a patient concern, people listen, not because of my credentials or my experience, but because I proved that I was willing to risk everything for what was right. Would I do it again? Absolutely. Every single time. Because at the end of the day, a patient's life will always be more important than a hierarchy, more important than a doctor's ego, and more important than my own career. That is what we sign up for when we become nurses. That is the oath we take. And that is the story of the day I was ordered to leave an operating room, and instead, I stayed and saved a life. If you have made it this far, thank you for listening to my story. I want to know, have you ever had to choose between following orders or following your conscience? Tell me in the comments. I read every single one. If you want more real stories from healthcare professionals, subscribe to this channel, and do not forget to watch the next recommended video, another powerful story from a nurse's real life. Thank you for being here.